This is Radio Health Journal. I'm Nancy Benson. This week, needle phobia.
I knew that if she reached up to pull that cord to indicate we're getting off the bus in front of that red brick building, that I was going to get a shot and I would go berserk.
One reason so many people avoid the doctor when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
How are the Keithleys or anybody else who are otherwise law-abiding, good people, getting whacked with the same consequences as, say, a drug dealer or a murderer might face?
How one voting mistake led to years of anxiety over possible deportation. Then,
engineering, programming, finance, medicine, everything. Behind the scenes, it's all math, it's numbers.
But what happens when someone messes up the math? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
58-year-old Laura Munoz of Palestine, Texas, hasn't liked going to the doctor as long as she can remember.
I've never liked needles, and doctors or nurses gave them to me. I mean, I can remember at 7 fighting the doctor because I needed a tetanus shot, and I had a big fight, and I got the tetanus shot.
That's not unusual. Most children are afraid of needles. But for a lot of people, the fear doesn't go away when they grow up. Laura's one of them. She says on a scale of 1 to 10, her needle phobia is about an 8.
I had some surgery as an adult, and I had some tubes for drainage for my abdomen, and one of the tubes fell out. And anyways, the fluid built up in my abdomen, and the doctor said, well, I'm going to have to stick this long needle in to remove that fluid, and then we're going to have to reinsert the drain. And I said, do you have to? And it didn't hurt, but it was awful. It really was. And the needle was really long.
They start squirming around in the chair and such, or they'll just ask the question. Many of them, or probably most of the adults, don't acknowledge it, but you can see by their body language, the look in their eyes, or just the way they position themselves, that they have this underlying fear of that, and they'll ask, are there any other alternatives?
That's Dr. Gary Leroy, a family physician in Dayton, Ohio, and president of the American Academy of Family Physicians. He's very familiar with needle phobia, both in his patients and himself, and how it often starts with a bad experience in childhood.
I used to love getting on a bus with my mom and going downtown because we'd get to shop and eat at restaurants. But I knew that if she reached up to pull that cord to indicate we're getting off the bus in front of that red brick building, that I was going to get a shot and I would go berserk. And then my mother would practically have to drag me or carry me to the basement of the City Hall building to get my vaccines. And that innate fear of needles just stayed with me. And so, yes, I looked the other way.
Leroy says that's what a lot of people do when facing an injection, swallow hard and look the other way. You may be surprised who Leroy says squirms the most.
The bigger they are, the worse they are for the most part. Men tend to, at least in my practice, the big burly men tend to be most fearful, although they may not acknowledge it, but they're the more fearful of individuals with kind of needle phobias.
While you may hear about people who have to be held down to get a shot, Leroy says that seldom happens, at least with adults. Those who are that badly needle phobic usually just get up and walk out instead.
Even if you could give a vaccine with a needle and there was 99% assurance to the individual receiving it that it would not hurt, about 10% of adults still would not take that vaccine. But when you're a child, probably about 2/3 of children into their adolescence have this needle phobia, when in lessons to about 1/3 of adults. But still, there are individuals that no matter what, just the looking at a needle, some people can have these near faint or faint episodes just from somebody pulling out a needle, People can faint. Some are so fearful that it can result in seizure activity. So it's not a benign thing for some individuals.
Leroy says for a few people, the power of needle phobia seems so visceral that it fuels an opposition to vaccines overall. However, we may never really know how many people have needle phobia. Those who have it most severely simply avoid the doctor without ever saying why, and often suffer health consequences. But even those who are merely uncomfortable getting an injection may pay a health price.
You're diabetic. We're in an era where insulin and other medications can actually be life-sparing, life-saving for them. And so it's important for them to have this vaccination, or somebody that's been bitten by a bat or something, or some stray animal, that it's life-saving to receive your series of rabies shots and such. So explaining why, and then really acknowledging that this is going to hurt just for a second.
Leroy is most concerned about people with diabetes. Laura Munoz, for example. She was okay as long as her doctor could treat her diabetes with oral medication. But a few months ago, those drugs stopped working. She needed to switch to insulin injections.
So if someone else, if a doctor or a nurse were to give me a shot, if I look away and don't watch them do it, I'm okay with that. But with me trying to do it to myself, give it to myself, I can't. And I tried for 3 months to give the shot to myself. They're not painful or anything, or most of the time they weren't painful, but I just could not do it. And I was going to my neighbors and my friends and my boyfriend saying, hey, can you give me this shot because I can't do it? And I would always try myself because I don't think it's their responsibility to give me a shot. I think it's my responsibility.
So Laura started fishing for help by looking online.
It was suggested to sit in a comfortable chair and to relax and maybe listen to some nice music, and I did that, and that really didn't work. And then I went for some therapy, and I thought that might help, and that didn't work. And then I went to a hypnotist, and then I tried CBD oil, and that didn't work. And then I researched maybe finding a needle sheath, that maybe I could find some sort of sheath. If I didn't see the needle, I probably could do it because the needle wasn't that big. And I couldn't find anything, at least not in the U.S.
Fortunately, Munoz's boyfriend says he'll help with injections as long as she needs them. But not everybody has a helpful significant other. Leroy says sometimes it takes a doctor doing some homework to find alternatives to injections. Things like jet injections and transdermal patches, and numbing the skin before a shot is delivered.
There are other classes of diabetic medications, agents that we can use. And so we kind of step into some of those other categories by changing the dose frequency or strength of the medication, changing the class of the medication, doing more than one class in combination because they work in different sites and such in the muscles and the liver and such and the pancreas. And so you doing combinations of these things to hold off getting to the point where the person can be treated or has to be treated by just insulin or one of the other analogs that have a similar effect.
Needle phobia websites say many people complain that doctors are often less than sympathetic, as if somebody can just get over it. Leroy knows that's not true because he has diabetes too and had to work at treating it. He kept telling himself that injections beat taking lots of pills. But he says if doctors and parents were better about how they talk to their kids about injections, needle phobia might never take hold in the first place.
Parents should not lie to the children and tell them that it won't hurt. They need to be truthful about what is happening and that they love them, and this is not a form of punishment for them. I mean, some of your listeners, I'm sure, have been in the doctor's offices and heard children screaming and crying because they got their vaccinations. And so behind that door, sometimes there are siblings watching this, and then they're like freaking out themselves because they're like, oh my gosh, well, obviously Johnny's having a fit, so boy, I sure don't want to have one of those things. So again, it's trying to put things in perspective.
So if a child asks if it'll hurt, say yes, but only for a second. Explain why it's necessary. Then once they get through it successfully, maybe it's time for a treat. Not bad advice even for an adult who's uncomfortable getting a shot. You can find out more about all our guests through our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson. coming up next week on Radio Health Journal.
It's heartbreaking. If you looked at his chest, there's about 4 different scars on his chest, and those scars are never going to go away.
Parents who fake a child's illness to get sympathy, and doctors are often duped.
Then, coronavirus, a global health emergency. But how much should we worry here?
We're going to see many more of those type of folks who are anxious and concerned when they really have no risk for it.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.